Good evening. My name is Marcella Spady, and I'm the Deputy Director for the Division of Social Services. I want to welcome everyone to the DHSS Reimagining Service Delivery presentation this evening. And we welcome everyone, and we're just so glad that you're here with us to get this information and to offer feedback. So thank you very much. The agenda will consist of a project overview, a question and answer session, and then our closeout. We want to make you aware of a few things. Our exits, we have an exit here to the left, one here, one in the back here, and through the lobby, either on the left or right-hand side, there's exits. The bathrooms are right outside of the door to the right. Okay? During our discussion, we also want to make sure that, we kind of keep things in order. So please raise your hand if you have any questions or comments. And a mic will be provided to you. And if you're not comfortable speaking, please take that time to just write down. I think we have cards provided. Write those questions down, and we can have someone answer those. We also have an inner office moderator who will be assisting with translation and ASL support. Our Spanish interpreter is Greta Huber. And then we also have, with a special thanks to our definition and interpreting LLC, who is also providing ASL support. This is a family event, so please be comfortable and make sure that, everyone's respectful during the session. Also, we wanted to acknowledge that we have our Cabinet Secretary, Molly McGarrett, and also our Deputy Secretary, David Newman, in our audience today, so thank you. Also, I just wanted to say that what's going to happen next is that we're actually going to do a presentation, and I want to introduce our Deputy Secretary, Daniel Walker, who is going to present that presentation to us. So Daniel, thank you.
Thanks, Marcella. I also want to note that this event is being live streamed. For those of you online, especially through our Facebook platform, please feel free to use the comment section to submit your questions and your feedback. We will be taking questions not only from those in person, but also those who are viewing virtually. We will also post this recording on our website and our Facebook page, so it will be evergreen. Thank you, Marcella. As Marcella stated, my name is Daniel Walker. I am the Deputy Secretary for the Department of Health and Social Services, and I oversee our Service Crusader divisions, which consist of our Division of Social Services, Division of State Service Centers, and our Division of Child Support Services. I'll provide a brief overview of our initiative, and then we will open it up to a Q&A with not only myself, but some of our department leadership who is here. We understand that our state service centers are vital entry points to services across the state of Delaware. We have 15 individual service centers, all of which are located in communities that need them the most. But it's no secret that these service centers have been located in these communities for some time. When it was first initiated under Senator Charles Debnam, we wanted to have one-stop shops for our service centers. And we want to ensure through this process that we are constantly reevaluating what happens in those service centers, but also how we as DHSS provide vital and crucial services to the communities that need them the most. Next slide, please. So the State Service Center Reimagine project is an initiative of the Governor's Family Services Cabinet Council. This council was established by an executive order in order to design services specifically for our service users, and to also ensure that we are being more conscious and intentional about the types of services we deploy. And so it is also helping to streamline our service delivery as well. And so it is extremely important when we think about this project because, as I stated, these service centers are front doors. They are the entry point that a lot of individuals use to engage with the Department of Health and Services. An example of some of the services that exist in these buildings, you have everything from Medicaid eligibility. Over 300,000 Delawareans are on Medicaid. On our EBT program, over 100,000 Delawareans utilize EBT. These buildings also house public health clinics. They house our emergency hotel motel voucher programs. They house our kinship care programs. They also house food pantries. They work to offer referrals to nonprofit organizations. They house our community support and partnership unit, which connects individuals with nonprofits across the state of Delaware who are doing the work directly in the neighborhoods in which you all live and exist. Next slide. Our goal for this project is easier access to services for individuals and families across the state of Delaware. This project is threefold. We know, again, that it is important to make sure we get this right. And so we decided a three-step process. The first phase is the research phase. This phase started over a year ago, in which we engaged staff members, state leaders, elected leaders to determine what they want to see improved. We also looked across the country to see how others are using services, to see if we in Delaware are deploying and employing the appropriate services. I got my start in community grassroots organizing, and we wanted to be intentional about engaging those who actually use our services, use the buildings, not just work there, but actually interact with DHSS on a daily basis. A little later, I'll describe the efforts we put in place to get the community engagement and feedback, but the community engagement phase was important to us, and it was important to me. I'm from Dover, born and raised in Dover, Delaware. Before it was called Bay Health, it was Kent General Hospital. That's where I was born. And I lived right in Capitol Park, Simon Circle, Capitol Green, visited Manchester Square, came to the Dover Library before it was at this location, and it was in the other area. And we know that no one part of the state is the same. But everyone is impacted by healthcare, housing, and food. From Wilmington to Georgetown, from Seaford to Milton, everyone is impacted by these vital, necessary factors. And so engaging the community, we as a government cannot build solutions for individuals without talking to individuals who utilize them. And so community engagement was important. And we want to keep it throughout this process. Phase 3 is what we call solutions testing. It's just a fancy way of saying we want to do stuff. And we want to try to do stuff. And if it doesn't work, we want to try again. This is what I call the spaghetti method. Throwing a noodle at the wall, seeing if it sticks. But using research, data, input, feedback in order to get there. Next slide, please. So this project, I talked about the 3 phases. This project It's not going to be done in a year or 2 years, but it will be done throughout what I like to consider, we modeled it closely off of Del Dot, and we'll talk about that a little bit, but it took them 5 years to get it right, and they're still changing. I know when I first got my license, I did not want to go to the DMV. I don't think anyone was like, I'm going to go spend my time at the DMV, I'm going to have fun. But they put a lot of work into making sure the process was smooth. So we have, from December 2021 to May 2022, that was when we did our research phase. June 2022 to January 2023, that is when we did our community engagement phase. And so you're probably asking, well, what have you been doing since January? It's June now, right? July. We've been taking everything we heard and developing solutions and plans to see if we can put what we can put in place when we talk about our solutions testing. We expect our solutions testing to take not only up until January 2024, but beyond. Next slide, please. So, how did we go about getting our findings? I shared that we engaged community members, but we also engaged staff members. And I have some numbers here for you that I think are impressive, because we did not want to design from the top down. We wanted to engage community in this process. So we used surveys, focus groups, and interviews online, on the phone, and face-to-face in order to get our feedback. We used over 166 individual responses from an internal survey covering 39 zip codes ranging from ages 18 to 65. We held focus groups in English and in Spanish with actual service users, not those who didn't step foot into service centers, not those who are unfamiliar with DHSS's service offering, but those who actually interact with us on a daily basis. And we also deployed an online survey where we had 942 respondents share their suggestions for improvement and feedback for how we are doing. And something else we did, because I did this in college to make a little bit of extra money, we had secret shoppers go into all of our service centers, and the staff didn't know about it. I didn't even know when they were going in. I didn't find out till it happened. We wanted to make sure that we had on-the-ground feedback. We trained the secret shoppers in what they were supposed to receive, and then they told us what actually happened. So it's not lost on us that we have work to do. It's not lost on us that we have people who have fallen through the cracks. I can sit here plain-footed and say that we know that is the truth. No matter how well-intended our staff is, and trust me, they are serving over 800,000 interactions in the year. We have over 800,000 visits to our state service centers across the state of Delaware. And so we need to ensure smoother processes, we need to ensure better staff training, and we need to ensure more transparency in the process. So we found all of that, and it came into 5 focus areas. 5 areas that we say we want to focus on improving over the course of this work. Area 1 is our client service delivery. How we deliver services to the clients. We want to focus on our employees. They are our frontline workers. They are the individuals people interact with. They're the individuals you all interact with when you come into our buildings. And guess what? They deserve our best support as department leadership so that they can do their best at supporting you. Technology. It's a little outdated, right? One of my first jobs was down in Carroll's Corner, thanks to Jobs for Delaware graduates. I was a tech assistant, and the phones I answered at 18 years old are the same phones some of our staff are answering now. It's a little outdated. It's all right. We recognize that. Facilities. You deserve to walk into clean, pristine, updated, modern facilities. Clearly labeled, clearly understood what you're going to receive. And guess what? Our staff deserves to work in clean, modern, updated facilities. There's one facility I will not name that I saw the paint color and I was like, ooh. But don't worry, we got you. We got you. And meeting involving client needs. This is one of the most important. We know that the services you need this year were different than the services you needed last year, different than the services you needed in 2020, because what happened in 2020? And then we know it's going to be different than the services you need next year. We want to constantly be able to meet those needs and evolve. So, what are some of the findings? I said a little bit of it. But services are difficult to navigate for users and for staff. We have dozens of programs. And it's our staff's responsibility to stay aware and knowledgeable about all those programs. Services are not easily accessible. And these are services you all are rightfully entitled to. We should make it easier to access these services. And we plan to. Employees. We need to improve our customer service and our knowledge. And what we also know is that the service is inconsistent from service center to service center. As we like to say it, when you visit one state service center, you visit one state service center. Technology. We put it in our budget request. The governor funded it. Our website at DHSS is outdated. It's not up to date with current service offerings. I work here, and I can navigate our website by using Dr. Google. Right? And so we know that we have work to do there. We also know that our check-in process is confusing and convoluted. And it's been noted. When people come in, some service centers you write on paper. Some service centers you take a name. Some service centers you go up to the person behind the desk and they write it down for you. It's different. There should be one uniform process, one experience when you walk into our service centers. I talked about outdated facilities. But also, the other thing that's important is privacy. When you walk into our service centers, and this is what we've heard from clients when they're asked questions about their experience over and over and over again. We're in Delaware. I see people I've known in high school at the local Wawa, go to ShopRite, Walmart. I see them everywhere, right? And it's no different in our service center. But you're telling your stories in places where people may overhear. But not only that, reliving very traumatic events over and over and over again. We have to do better. And then meeting evolving client needs. They are not the same year over year. People experience different things. And oftentimes, people have no clue about how we at DHSS can assist them. We have to do better. Next slide, please. So we have some improvements. I said all that to say we have some improvements, don't worry. We have some good things. We want to improve our process, make sure there's a standardized process at every state service center. And our division leadership, our department leadership knows this needs to happen for a better experience for you all who utilize them. We want to have an easier intake process. As someone who's utilized Medicaid and food stamps, saw my parents fill out the forms, seems they get longer and longer. And they ask for the same information over and over and over again. I'm going to get me some head nods. I feel like I'm getting the amen section. We have to change, and we plan on changing our intake process, our application process, one that is more user-friendly. Now, I'm not going to sit up here and say we can do it all in one day or that it's going to be an easy undertaking because Big Brother's always watching, the federal government. But we are committed to making sure we navigate that process so that it's easy for our service users as well as our staff to navigate. This is both and, right? A cleaner process for staff is a cleaner process for our service users. If service users understand what they're entitled to and what to ask for, they can help guide our staff in assisting them. It's a both and approach. We both benefit. We want to train our employees in trauma-informed care. We want to ensure that we ramp up that training. So when we're talking to people who go through something very dramatic, no one wants to come in and say, I can't feed my children. I need help covering my electric bill or we're going to be out on the street. That is traumatic. I sat and listened to those conversations when I was a child. And my parents never said it with a smile on their face. And so our staff, we want them to be able to react in a way that is understanding and compassionate. We want to create a better onboarding process for staff. Training is key. Training is important. Training is crucial. If you know what to do and you know how to do it, you can do it. Technology. We want to create an electronic check-in system. This is something that I love as someone who loves data. I love electronic check-in systems, but I also have went to a lot of doctor's offices lately, and it's so easy now, right on your phone. They have a QR code. I mean, DMV, you can check in from the parking lot. That's pretty cool, right? And so we want to utilize systems that are already in place across the state in order to do that. We've already begun to update our televisions in our lobbies that is sharing information in both English and in Spanish, and we're going to be looking at rolling out additional languages because guess what? Everyone who comes to our service center doesn't speak only English and Spanish. We have Haitian Creole, we have Mandarin. It's important that we are talking to people in languages that they understand. And again, making sure we have updated technology, because I think I did say it was old. Our facilities, we want to update our lobbies and our furnitures. We want to make sure they are ADA compliant and accessible. And we want to change the flow to allow for more private space. And as we move to conducting needs assessments for our clients, we want to do that in a consistent cadence. As needs change, we should be aware of that. The only way we can be aware of that is by talking to the individuals who are impacted. And then we want to make sure we are creating an awareness campaign so that people know what our state service centers do and what they can be. We are talking about designing a service center of the future, not just where you can come to a clinic, not just where you can get EBT SNAP benefits, not just where you can come and get Medicaid, but how can you plug in entirely to the state of Delaware's resources, no matter where you live, in an effective, efficient, and easy manner. That is what we're talking about here. So I said all that to say, why does this matter to you? Why did I ask you to come here and listen to this? Can we go to the next slide, please? Because one, we need your help to do it. And two, there are a few things you need to know. One, we have 5 focus areas, just to reiterate. We have client service delivery. We're focusing on our employees, looking at technology, looking at our facilities, and that crucial 5th one, meeting evolving client needs, making sure we are staying up to date. But it's important that you know it will take time. This does not happen overnight. We, like I said, we closely mirrored this off of something that the DMV did. It took them 5 years. But why does it take time? We develop something, we test it to see if it works, and if it doesn't work, we go back to the drawing board to see how we can fix it. It is important to make sure that we are not, and I repeat, we are not moving too fast, because we have to make sure the final solutions are the ones that work. I also say this is important, and why you should know about it is because the service centers you work in, the service centers you use, will have changes coming. And we want to know how those changes are working. Are they good? Are they bad? But just know that they are coming. I almost feel like saying winter is coming because I started watching Game of Thrones again. But changes are coming. We're going to get t-shirts. And fourth, we want your active participation. People call our office all the time, and we welcome that. We encourage you to still do it, because that is how we know what works and what doesn't work. We have members of our leadership team here, members of our community team here, because we want to know how you engage with us, how you feel, and how we can do better. And no one's ever been shy about giving us the raw, unfiltered truth, and that's fine. We encourage that. Next slide. And so what's next? As we work hard to implement these improvements, we know that it's going to take a while to happen. We want to make sure you know you can still contact us and that we are not done listening yet. We always listen, and we'll continue to listen. So how can you reach us? For those online, you can email us directly at stateservicecommunity@delaware.gov as you get feedback. One of the things we are immediately trying to do is make sure that we can receive customer feedback from our centers directly, so that we can know, as we implement these changes, what is working and what is not working. With that said, I want to open the floor for questions from in-person attendees or online. Before we do that, I want to bring up our division leadership. We have Director Renee Beeman, who is our director for the Division of State Service Centers. And we have our Deputy Director for the Division of Social Services, Marcella Spady. We also have some pre-submitted questions that we received from folks as they were signing on that we're going to go through first, and then we'll open it up to any questions from the floor. If you have a question from the floor, please raise your hand. We'll make sure we get a mic to you. Who has a mic?
Right back here.
If you have a question online for our viewing audience, please type it in the comment section. We will make sure it gets to those of us up here. And again, I want to say thank you for coming, and let's hear what you have to say. But I'm not done. All right, so this is the part where I get to sit down, I think. I also want to acknowledge Dr. Vi Cade, who's the superintendent of Capital School District. Thank you for all you do to support our young students and their families. So one of the questions that we were asked is, and Renee, I'll give this to you. What are the state service centers doing to help provide concrete services to the community? Furthermore, how are you meeting people where they are?
Well, I think that's why we're here this evening and with the town halls. I think it's very important that we identified that we needed to make some changes. We realized that we need to do things in a different manner. It shouldn't be additional stress when you come in. So all the things that Daniel had shared, we want to make sure that when you come in to our state service centers, you feel as though you're accepted, whatever your needs may be. That we communicate to you that we are here to help in offering those services. One important thing that he shared earlier on the slide, it talked about being trauma informed for our staff. That is key, because most likely for those who come into the State Service Center, they have a need, and most likely it's a crisis. And we want to make sure that we meet you, whether it's housing, whether it's food, whether it's Medicaid, whether it's child care, what your needs are, that we can match them, support you through this process. We can do better, and this is how we're going to do this through our reimagining.
Thank you. Marcella, this is for you. How do you, in the state service centers, integrate with the other DHSS divisions?
How we integrate is that we collaborate and go through all of the issues that are going through. We make sure that everyone is informed about how things should be. Right now, we do a lot of meeting between the different agencies to ensure that we're all on the same page. We know the clients that we serve. We have mutual, goals towards trying to get services out to clients, and that we work together to get through this process. I can say that whether it's dealing with how we do client services, how we improve the facility, that we're all involved in that. And when we discuss these things, that all of us are working together and ensuring that that happens. Right now, I know that we work together so closely. We talk about the issues that are coming through our doors every day. We talk about how we can better service the clients. And we look at the issues that are going on out in our communities. So with all of that information, we can get together, collaborate, and come up with real solutions for dealing with whatever problems we're addressing and how we meet the needs of our clients that are coming through our doors. So I think it's collaboration, and I think that it is just making sure that we stay informed about the needs of our clients and what needs to happen to get them what they need.
I have one more, and then I'll open it up to the floor for questions. So I see some minds thinking. What is the process within the state service centers for assisting a person who may be visually impaired or have hearing loss for accessing emergency needs such as housing or EBT cards?
Some of the processes that we have are very limited, and it goes back to what Marcella was saying about the collaboration. Through our division of visually impaired, we can easily call them and share that we have someone who is in need of Braille. We don't have all of our materials available on site, as well as our languages, something that we are working on, and we're learning from the community of that need. Also, what we want to do is to continue to have the ADA be at the top tier of that, making sure that all of our buildings are accessible. Whether the need is visual, whether it's mobility, whether it's hearing loss, we have to make sure that we provide that communication. Because if there's a break in that communication, the assessment and the needs, and we won't be able to fulfill them. So what we're looking at with this reimagine, what can we bring in or what can we have that can be easily accessible so it can reduce the stress of someone coming in thinking that they won't be able to communicate properly with us. So that's, again, what we're trying to do is bring about the assessment, the needs, so when someone comes in, we can meet them at that level. With EBT, I'm not sure if you want to share what we would do, or that would be the same thing.
That's true also with the EBT services. We meet constantly trying to improve those services, making sure that clients, when they come in, they can get those cards as soon as possible, making sure that our processes are easy. For example, if a person comes in and they get emergency food benefits, that they can pick up that card within 24 hours and be able to, access their food benefits. We also are doing a lot with making sure that when they come in that we are able, sometimes they don't have an ID or those types of issues, that we work through those types of situations so that they can still get those services as soon as possible. Also with the EBT, we want to make sure that when there's issues with their card and they're calling our 800 number, that those the customer service through that is done properly, and that client is able to reach who they need to reach and get their services taken care of. So we're doing a lot with that and improving it, and I think that will really go a long ways with our clients.
One of the things, and since I have the mic, I get the privilege of answering any question I pose. One of the things that we have acknowledged is that we definitely need to have, and I think Marcella and what Deputy Director Spady and Director Beeman acknowledged it, that we have to have a greater integration with those other divisions outside of just DSSC and DSS. Individuals come in what we call with multiple barriers to access, whether it's language, whether it's hearing, whether it's being able to see. My mother is visually impaired, so she's also someone who doesn't mind speaking up for what she believes she is entitled to, and we appreciate that. Right? We have standards, and this is me saying we have standards that we are supposed to follow, implied and imposed on us from our federal partners and as well as our state partners. And if you ever feel like you're not getting access and we're not meeting those standards, there are channels and ways that you can get it up to our offices, as well as our customer relations team and our constituent relations team, who do wonderful work in making sure that they are your advocates, making sure that we hold true to our promise to deliver those services. And so, yes, we understand that sometimes we fall short, and we are working on them, as my colleagues have said. But at the end of the day, you still need help and you still need services. And so we say, don't be afraid to pick up the phone. Don't be afraid to walk in. We welcome it. Do we have any questions from the audience or any questions online? We'll wait till she gets the mic over to you.
Good evening. First of all, I want to say thank you for having this. My question is, I have a friend who's 86 years old. She has a handicapped daughter, and she is only getting $60 in food stamps. She's not computer literate, so it's kind of hard for her to get to the office to talk to someone. They're saying, oh, well, you got to increase because you're on Social Security. No, she has a mortgage. She has different bills, and it's also for me too. My thing is, because we got a little increase, now we are not able to get food stamps. And that's not fair when you have girls out here getting $1,200, $1,300, $1,400 because they got 8 and 9 kids. And that's not fair, especially when they're able to work and we're disabled. We cannot work. So something needs to change. And like I said, for her, she's in her 80s. What can she do with $60? Nothing. So I don't know. Can I get some answers? Hopefully it will change, but she needs help.
No, I appreciate it, and thank you. And I don't, so when we talk about programs that offer assistance, and any sort of program that offers assistance, first of all, I want to say we in our roles and people who work within our department should not ever dismiss someone's situation or feeling. So I'm sorry that happened. The other thing I also want to state is there are many times in which we are bound by federal restrictions in what we can do. And the SNAP program is one of those programs by which we are bound by federal restrictions. All that means to me, when you call your caseworker, your case manager, is that we need to get creative in how we assist you. Connecting you with the right benefits, connecting you with our partners in throughout the state. We have a lot of nonprofit partners who do this work, who provide those what we consider gap services that we may not be able to provide. And if we cannot provide it for you, it's our job to make sure we point you in the direction of someone who can. And so please, before you leave, please make sure you provide your information and we can follow up with you and your friend accordingly.
Also, one of the things that we can look at in that particular situation to see if there's deductions that could help, the person get more benefits. So that's something that when we get your information, we can take a look at that. So we are bound to certain rules, but there are certain deductions. Like there might be, like if the person is paying additional medical expenses and those types of things. So we need to look and see, is there another way that, you might be able to get additional deductions that will help assist with more benefits.
I think as well, just before the answer, I think as well, we want to create almost a lifeline so that your friend doesn't have to be all alone, that maybe there's a number or someone that she can call and not sit in this state of just having the $60 and struggling. That really is what we want to do, to be able to help. Obviously, she needs some help. And having that creativity is going to be real important for us to figure out how we can help her. And that's what we're trying to do.
Right behind you.
Thank you. Hi, my name's Amy Yarnell, and I actually serve the United Methodist Church across the street. And this is my 13th year in our community. So I have a fair bit of experience, along with Janine and others, of trying to serve people in need in our community. And I could tell stories for days, but I'm not going to do that. I'm just going to ask a question. You just referenced your nonprofit community partners. And I will just say broadly, over more than a decade, we have had an increasing struggle of maintaining relationship with social services. And so, the staff person that used to take our call every time we called has been out of that job for several years. We have never been able to secure another contact person. So just on broad strokes, is there conversation and plan about how to make sure that the community partners, because we provide roughly $10,000 a year into the community of people who fall through the cracks, who don't qualify for this or that and need something. We would really like to have that contact improved again. So I'm guessing there's an answer to that.
We appreciate you so much. Community resources have been almost the part of the heartbeat of the state service centers, because oftentimes individuals aren't eligible for the programs, and people don't realize we have to do that eligibility aspect. So we would pick up the phone and we would call you and tell you what our needs are. And you are absolutely correct. Just before COVID, we started to see a challenge because we had so many people coming in, and it took away from that relationship that we were building. And COVID just made it absolutely crazy. So part of what we're trying to do is rebuild that relationship. We have 15 state service centers with other agencies within, not just state service centers, social service, DPH. The goal that I want for our administrators, and they want it so badly, is to now go back and reassess. We've lost some of our community resources because of COVID, but we have to have that relationship. So we are working extremely hard, and we're trying to figure out how best to do it. We do have, we're going to reinstitute or make sure that they're happening, and those were our area meetings. We would have meetings at our state service center, our community meetings, where everyone would come in, share their programs, and we would share what's happening in the community, what's going on. We have to make sure that those are happening, and we will, because we need you.
So make sure, one, we get your contact information. Also, in addition to the community meetings, the area meetings at our state service centers, our community partner support unit as well is also available to support our community partners. We also have our community partner portal where if you are not signed up to help people with their applications in applying for services, that is something we also do. We work with a number of nonprofits in the Dover area actually to do just that. So there are a number of ways, but give us your contact information. We'll make sure we get on the list. And
We also have meetings, so we would definitely want to add you to that. So, because a lot of other, people experience, things, and that way you can talk about it, and we can talk about how we can better service you.
We used to have good ties between the ecumenical groups.
Mhm.
And I think if we could just tie into the ecumenical group, I think if we could just reestablish ties with the clergy groups,
Mhm.
the word would stay spread. We just need to reconnect with the secretaries of those groups. Yeah.
Yeah.
We will. We're trying to reset a bit, so we will, but thank you.
Yes, and we actually have like our SNAP outreach program, and they deal with a lot of different groups as well, like for the food benefits. So, we just need to make contact and get you some help. We can do that.
I think we have another in person, and then we want to get to some of the live streamed questions as well.
Good evening, everyone. My name is Tracy Palmer of Tracy Palmer Ministries. So I fill in the gap a lot because I have a food pantry, and I get thousands of dollars worth of food delivered to my pantry, frozen fruit, foods, non-perishables, everything that you would go in Food Lion and get. I have access to it. So I can also be a resource. I am a CPSU partner, and I am also in a signed MOU with the state of Delaware as well. But I want to go back to something else. I would like to make a strong suggestion. Because I do a lot in the community, I don't like to call them homeless, I like to call them our neighbors in need. Because I work with them a lot, and we do have a homeless shelter for women, so my hands is tied into a lot of things. But what's very discouraging for a person who is having life happening is for them to go to the state service center, and they're treated and talked to and belittled already in their situation. And I've gone with some of my clients to a few of the state service centers and have been utterly disgusted by the tone of the worker behind the desk, to the point of me saying, this is not your money and this is not your food stamps, and you don't have to talk to this person like this. So my suggestion, if I can make one to you guys, before we talk about delivering the services, let's really educate the workers so that the services can be delivered professionally, productively, with respect and with dignity. It makes a world of difference. I once sat in a seat where I needed help, and that's how I got into doing what I'm doing, because of how I was treated. So I just wanted to say that.
And good to see you again, Tracy.
Likewise.
I appreciate that because that's not the first time we've heard it. And we, during that five-pronged approach, those five focus areas, that's why we explicitly called out employees around trauma-informed training, navigating customers, having conversations with our clients, and being able to understand that people are not coming to these buildings on their best day. Oftentimes they're coming in very vulnerable places, and it's our job to welcome them and help usher them through their service journey with us. And so I appreciate it, and suggestion taken, and we are working on that. Actually, we have one of our staff members who's in the back who was dedicating her portion of this work entirely to employee training.
I'm sorry. And I also have a resource room as well.
Thank you. All right, we want to get to some of the online, and we'll come back to the in-person as well, but
The first question we have from the live stream is, how do we determine if someone is eligible for food benefits?
so we do have a process for eligibility and determination of food benefits. The first thing to do at a quick glance is to always call and apply for the benefit. The worst that could happen is the answer will be no, because you're ineligible, but you don't know unless you apply. If you're unsure and don't want to waste the time, as I've had some people tell me, you can go online, and we have our guidelines for what determines eligibility at a high level. That can give you a first glance look. But always, if you want to know if you're eligible, just apply. You can apply online, and you can also apply in person.
And I would have to say that also it's important that the information that is asked for the application, that's provided, because there are a lot of times when it's not denied because of the actual the benefit. It's not denied because of the income or something like that. It might be because we didn't get information. So very important that we get the information that is required to make the determination.
Thank you. The next question from the live stream is, what is the process in assisting someone who has a traumatic brain injury with filling out forms?
So we never discourage anyone from coming in or calling us, do both. We always ask that if you need assistance filling out our forms, please disclose that you need assistance filling out our forms. Like I said, they can be cumbersome, even for the best user. In terms of a traumatic brain injury, we would work with our partners in our sister divisions to ensure that not only we're working in the most appropriate way possible, but that they are getting access to all the services that it may not be services within our divisions, but if you walk into our building, we'll connect you with our sister divisions that can meet that need.
I also wanted to say that the person also, if they have someone that we can work with as like an authorized representative to help us get through that paperwork, we do that as well.
Thank you. One more question from the live stream, and then we can shift back to the room. When will PEBT be issued?
Yes, right now we're actually working on that. So we, on our website, will actually say exactly the dates that it will be issued. We did get approval for the summer. We're currently working on the school year for the children. So as soon as we get that information and get the dates established, that will be on our website. We also send out information to the families who are eligible to let them know.
Thank you. Does anyone have questions in the room?
Thank you. Janine Climo with the Dover Interfaith Mission for Housing. Two unrelated questions. First one is, what do you do in a case of someone having insufficient or no documentation?
We do work very closely with, if there's information that we can get, whether it's through vital stats, if you don't have paperwork, we do that. We also offer assistance wherever we can to help people get that information. Sometimes if we have people who are undocumented, for example, we'll try to help them as best we can to get their information. So it's really working very closely with the workers, and sometimes we're able to work with other organizations who help us with that as well. But it's something that if we know that you need that help, we will certainly assist you.
Okay, thank you. The other unrelated question is, with housing being such a critical issue, what is the agency's efforts to collaborate with the Delaware State Housing Authority?
Housing, as we know, we've been doing this for so long. We have not enough housing, inadequate housing, expensive housing. We have, and I think during the COVID, really brought a lot of the housing partners together. On the state service side, we are the safety net. We provide that emergency housing in order to try to keep people safe until we can do a warm handoff. With the Delaware State Housing Authority, we've been able to, through meetings, to find out what the resources are. And a lot is finding out what individuals need and making sure we can match them. So with Family Promise, with Delaware State Housing Authority, many of our other organizations, and I'm so excited to see that there's more housing that's nonprofits on a small scale, and we'll take that, are being generated. But we are communicating and for that next step, because the goal is we really need to help people get stable housing. Without, you know it, without housing, everything kind of just falls to the side. But we're really looking at how can we improve even the emergency aspect of it. We utilize, probably when I first came on about 9 years ago, maybe about 38 motels and hotels. We're probably down to about 20 now because of the conditions and because some of them during COVID needed to be revamped. So we are down as far as emergency housing. When it gets to the summer, I love the summer, but I'm always thinking about, oh, Sussex, we're going to lose some of our motels and hotels because they tell us it's for tourists. So we have this challenge. I had the opportunity of traveling to Houston with the Deputy Secretary to see what they're doing, and it's kind of sparked with us. We can be more creative. He's working me, telling me we have to be more creative in some of the things we have to do, and the Delaware State Housing Authority is part of that. We're really trying to learn their programs and educate the community about it. And thank you for all that you do.
And just one more thing, because I spent a lot of time on housing since I've stepped into this role, because it's an issue. And as someone who was unhoused for a majority of my life, it's pretty important to me. We are being intentional. I use that word consistently because that's what it takes, is intentionality in order to reverse some of what we're seeing on the ground around not just collaborating with the Delaware State Housing Authority, but truly integrating our services. And so we do emergency short term, they do long term. We need to fill in the middle. We need to fill in the middle. That's done with our housing partners, some of which are in the room, but that's also some of the work that we have to do on the state side, and they are along for the ride. Delaware State Housing Authority. The importance of Delaware State Housing Authority is that they do Kent and Sussex. And for folks who are watching in Newcastle, they, our Newcastle partners, Newark Housing Authority, Wilmington Housing Authority. I've talked with plenty of them, and we all want to take a collaborative approach. The other thing that's important to note is that we do have a seat on the continuum of care, which is the federally mandated and regulated entity that provides funding to community organizations that are doing and using a housing first model. Understanding that if we house people, we can provide the services where we know where we can reach them. Another question. Hi.
Hello. So, first of all, thank you all for first and foremost acknowledging all of the issues, because nothing can change until you acknowledge that change is needed. So, even though it's a sticky situation to approach and it's not the most pleasant, I do appreciate the fact that you guys have acknowledged. One of the things I wanted to piggyback off of, which I initially thought of before Tracy had touched on, was the communication with employees. So it makes me wonder, what is the process when it comes to hiring employees, and are they being asked the right questions so that they have the right mindset in taking the position? Because oftentimes in communicating with them, they think that they know it all and they talk over you, and they actually don't know it all because they miss a lot of things because they're ready to communicate an answer instead of gathering all the information to effectively serve. So that's one of the issues. And then my other question is, what is the level of accountability when it comes to employees? Because oftentimes when I have to call one of these agencies through the state of Delaware, I'm not the one who will banter and go back and forth. When I feel like the conversation is not making progress, I will immediately cease and ask for a supervisor. And if that's not accomplished, then I will definitely research to find rank to talk and communicate. But what sits unwell with me is that's more often the case than not. That seems to be the standard of service and communication that we're receiving from people who work for the state of Delaware. So it makes me wonder, like, are they here just because they want the benefits and then they think that they can just treat people and talk to people any kind of way? Because obviously I don't have a cognitive impairment, so I don't know why you would talk to me that way. But at the same time, it doesn't matter because it makes me have compassion for the person who does and who doesn't have the ability to advocate for themselves the way that I can. So those are my core issues. And then also, too, on the flip side, I feel like there should be some type of incentive for employees who really go above and beyond so that they can really be highlighted, those who really have the compassion and the empathy and who really connect with people. I think there should be some kind of provision made for that.
I appreciate that, and thank you for coming and sharing. The process for hiring an employee is one in which we alone, as the Department of Health and Social Services, do not solely dictate, but it is one in which is a sort of state collector. So we have the Department of Human Resources in the state of Delaware. There are some boxes we have to check there, but and, and if you talk to our staff, we know that we need to do a thorough vetting job. And so we're talking about how do we hire for the core competencies, and you don't need to know how to process food benefits or Medicaid to get hired. We'll train you how to do that, but you have to be able to respect and engage with the individual you're working with. And so one of the feedback sessions that was held brought up about making sure that we're hiring for attitude and training for aptitude. And so that is something we are looking and working with DHR and our leadership to develop a process for making sure that our staff are trained and hired with that in mind, but also continually training them. The work we do is traumatic. The work we do is hard as well. So I do want to acknowledge that for the staff. They are working with people who, have very real challenges. And so we want to make sure that we're giving them the support to not internalize that and let that dictate and impact how they provide the services, but to be able to recognize it and respond accordingly. So absolutely, that is something we see. And thank you. Do we have more online questions? One more in person, and then we'll go online. And I'm looking at the team to make sure I'm not going over time. I think I heard a yelp. It's okay. All right.
I'll try to be quick. I am Teresa Morris. I'm with the Choose Joy Foundation. I don't like speaking in front of people, so I'm going to try to be real quick. I appreciate that Gail invited me today so I can be here and learn a little more about how you guys are making changes. Being another nonprofit in our community that helps folks who end up homeless. My folks end up homeless from house fires. And that is a gap that seems to be really huge and not addressed at all. I have a client presently from Sussex. We're working real hard with a real estate agent who volunteers her time to help her obtain a new Section 8 apartment, who is having to pay out of pocket for a motel room because she was only given 2 weeks of help. She's a senior citizen who is on disability, who's raising her 15-year-old grandson. And I guess my question is to you is, how do I help this woman? I strive to not duplicate services, so I refer people to Tracy over here for food. But the housing is a huge issue. And there are so many ways that we end up homeless other than just addiction, but that seems to be the main focus. And when my folks go in and ask for help, they receive the same attitude. They're thrown in a box, and they're not listened to either. So I guess that's my question. How are we going to help those folks who do get dropped, especially with the housing?
Yeah, folks falling through the cracks with some of our very strict and stringent requirements is real. It happens. And we've been having conversations and planning. Actually, Director Beeman and team have been looking at how can we support nonprofits who do that work, and also how can we create some sort of a fund or something internally for people who don't qualify for our strict. And I intentionally use the word strict because they're very defined, right? It's true, and as you put it, it doesn't necessarily meet every situation. And so we've been trying to figure out how can we be more versatile in our in our allocations to various organizations and entities. We would love to learn more about your specific viewpoints and perspectives because that can help inform how we are engaging with our staff and creating something that's a little bit more versatile and flexible. But it's something we've acknowledged, and we know we need to create something that is not as strict and stringent. It does require finding a funding source that doesn't have those requirements tied to it. And I do want to, I've been very straight and honest all night, and I'm going to continue to be, but we ourselves have our hands tied, but we are in truly trying to get creative. We'll take a few more online, and then I see we went to the white screen, which means I have to wrap up soon. That's my cue. But we'll take a few more online. If you have any other questions, we can certainly make sure we get those and we can follow up accordingly.
This is a written-in question from the room. Are there any plans to provide more access to dental services in the adult and geriatric population, especially since clinics have closed?
So we have, that's a great question, one I did not come prepared to answer. But in terms of dental services, we have what we consider our federally qualified health centers, our FQHCs, and we have been working with them around dental access and dental care. And so I'll say more on the way, but certainly We can, yeah, right. We have been, and also I know that services are covered for populations that they weren't covered for before. And so what we'll do is we can make sure we get specifics, but I know our secretary is here, and I'm going to put her on the spot about our divisions that are working with dental care.
And I'm going to put Dava on the spot too. Our Deputy Secretary. Hi everyone, good evening. Thank you so much for being here, Janine. I don't know if you remember me. I was Molly Drusik back last time we heard. Yeah, your name. So we have actually during the Carney administration, Medicaid added adult dental services. So that now is a program under Medicaid. We're working with Senator Sarah McBride, who is the main sponsor, to look at the levels. We've heard from people that it's better than nothing, but there's still a lot of, when people have very extensive dental needs, having not had dental care for a while, this benefit isn't meeting the need. So that's something we're actively looking at and working with the legislature. And then also with Senator McBride, we worked with them and the Dental Society to basically not lower the standards. We're still having strong standards, but have an easier licensure process for dentists that want to work at federally qualified health centers. So Westside Health, which has a facility down here in the Dover area, has said that they're actually going to be able to fully staff their dental clinic for the first time in years because this change in policy has allowed them to actually hire people because they used to have a residency requirement. They had to pass a very stringent test. And so we've changed that. So we're very excited to, not saying that those are going to solve all the problems, we need to keep talking, but very excited that there's been 2 substantive changes that directly go to access and payment for dental services. And then Dave, is there anything you wanted to add on the DSAM side? Because DSAM just opened their dental clinic.
Discussion around services for seniors. So I just want to remind everyone that in addition to social services and the state service centers, under the Department of Health and Social Services is the Division of Services for Aging and Adults with Physical Disabilities. So in the future, we're going to train our state service center staff more thoroughly on what those services entail and be able to do warm transfers and handoffs. But in the meantime, if you're dealing with a senior or somebody with a physical disabilities, reach out to the Delaware Aging and Disability Resource Center. It's delawareadrc.gov, I believe. Or you could just Google Delaware ADRC and look it up, and you can get services from other DHSS agencies. Yes, I walked in when you were talking about food benefits for seniors. There are some other food programs available through both Medicaid and non-Medicaid funding. So Meals on Wheels, which is a hot meal delivered 5 days a week, is an option and is available even if you are getting other food benefits. So it's something to consider.
One final question from the live stream before we close out. Is there a plan to let applicants know where they are on the waiting list when services aren't available?
When you say, okay. So on a waiting list, there's a few different plans. One is understanding where you are in terms of when you apply for a benefit. We have something we're trying to make externally faced now where when you apply, you know where your application is in the process. In terms of the waiting list, a lot of our services don't necessarily have waiting lists per se. It does take some time to process the applications. Now, there are other services within the department that could be deemed a waiting list. And we just ask that you work with your case manager in order to identify where you are in that process. One of the things we've also heard is that the housing voucher or Section 8 voucher waiting list, we know that they are behind. That is true. That is managed through the Delaware State Housing Authority. And so we always say work with them to identify where you are on the wait list. In addition to the SAPIT, there were some questions around what individuals who are facing other challenges that we did receive across the online platform. We also have our division for visually impaired for those who need services there. You can reach out. They are also on our website. as well as our divisions for individuals with disabilities and disability services, developmental disability services as well, if you need services through them. What I want to say is thank you. I know we have a couple other questions, but I'm getting the wrap it up button signal, and we do have to be out of here at a certain time. I want to say thank you for participating, for those who are here in person and also those who are here online and viewing virtually. This is not the last town hall that we will have. We have a series of town hall sessions planned. They take place. We have one happening this weekend as well in Newcastle County at the Route 9 Library. We also have one happening in Georgetown, and I'm going to get the exact dates, on July 18th at the Georgetown Public Library. And we also have one on July 26th at the Wilmington Public Library. There will be a resource fair set up at each event, as well as the ability to ask questions. If you did not get your question asked today or answered today, please follow up with us at stateservicecommunity@delaware.org. Submit your question. We will answer it, or you can attend one of the other service center town halls. We will be happy to answer your questions there as well. With that said, we have a feedback survey. Please, you can scan the QR code. For those online, you can click the link. We want to hear your feedback. As I said, we're not done listening. We want to hear what you have to say. Please keep us in mind as you are going and working and experiencing our state service centers. We want to know what you're experiencing on the ground, and we want to know how we can help. And for our nonprofit partners, we cannot do this work without you. So certainly, thank you, thank you, thank you, thank you. You fill in the gap every day, and we want to make sure we continue to build stronger and closer ties. With that said, everyone have a good night, and we'll be in contact more.